I'm going to demonstrate on a SurgiSTUD shoulder model placement of a encore reverse total shoulder arthroplasty. We're doing a standard deltopectoral incision. My coracoid process is to the right. This is the right shoulder. My clavicles to the upper right and my acromions to the upper left, cutting through the subcutaneous tissue with skin, and you can see it's got a real feel to it. I can bluntly dissect this, or I can sharply dissect it. I've got a Wheatlander self-retainer to just demonstrate the retractability of the tissues. We're going to do the deltopectoral, the clavipectoral fascias, also incised and retracted out laterally with the Army-Navy. At this point, I'm demonstrating the pectoralis tenodesis of the biceps tendon right above the pectoralis tendon. I'm using a blue nylon suture just so you can demonstrate and see it easier. It has a real good feel to the tendon itself, a realistic deltoid end pectoralis tendon, and you can see the rotator cuff and capsule up above. This is the entry point coming into the interval for the rotator cuff release off the front of the humeral head. So I'm resecting the biceps, going to follow it up the interval, releasing the subscapularis off anteriorly, as well as part of the upper supraspinatus, releasing this off the humeral neck. And capsule is going to be coming slightly medial to this, releasing it again with a good feel to a normal tendon structure. The remnant of my biceps is there, and we're going to resect that at the top of the glenoid. At this point, I'm doing further release of the capsule around the glenoid and trying to release around the inferior humeral neck capsules to get some mobility to the proximal humerus, which is a very realistic situation. I'm drilling in my proximal humeral cutting guide, the Encore system, in 30 degrees of retroversion here. The bone drills, cuts, places pins and screws, much like normal bone, and as you'll see, it will cut the same way. There's a feel of both the cortical and cancellous structures when you're cutting through, and reaming as well. So I've got a superior Homan and an anterior retractor just protecting soft tissues as we resect the humeral head. The bone holds the guides with the pins in an appropriate fashion. Here I'm doing further release for glenoid exposure. I've got a posterior glenoid retractor in place, retracting the proximal humerus out of the way. There is appropriate tension here, so you do have to do standard releases to gain exposure, and you have to have good placement for your retractors, and this model allows for it on a repeated fashion. It's very durable as far as the structures releasing. I've done a drill hole through the glenoid, and now I'm putting in my glenoid tap for the glenosphere, and you can see my tap line. I'm going to bottom that out, and I've got a good feel of it, good structure on the bone, and it's holding well, and we'll be able to use the glenosphere, the base plate reamers right over the top. This has a slight curvature to it, but you can see the reaming is fairly realistic as far as a good feel of the bone. I've removed the tap, and now I'm placing in my base plate itself. The structure here is quite normal. The alignment to the glenoid is in a neutral and inverted 30-degree alignment, but this SurgiSTUD model can also handle any alignment to the glenoid, such as retroversion or a B2 glenoid. So this is something that is not available in cadaver labs except by luck, can be predicted and done in a routine fashion with the SurgiSTUD modeling and the 3D printing. So it can make really difficult primaries for practice. You can see the feel of this base plate going in is very realistic. I can snug it, and it has a good feel. I'm going to use a 4-in-1 drill guide. I've got depth lines on my drill, and you can see I can drill through and get the feel of the second cortex as in a real situation. The quality of the cancellous bone is quite good. It's not powder, it's not dust, it's very realistic, and the feel of this bone is good. I'm putting in one locking screw just to demonstrate it here in my base plate. You can see my anterior retractor also is along the anterior-inferior aspect of the glenoid there. And my posterior retractor is retracting out. I'm going to put on a trial glenosphere here. Again, there's appropriate tension to the soft tissue, so I have to place my retractors appropriately and or release more as I need to gain exposures for these cases that is necessary. Once I'm on, I can impact this lightly, take off my little handle, and impact it with the full impactor to seat it on the taper. And that has a normal feel. My next step is going to be preparing the proximal humerus with a hemispherical pineapple reamer. Then I can sound the canal with long-handled reamers, and now I've got a broach that I'll put in at about 30 degrees of retroversion based on my guide at the top of the screen there, following the alignment to the elbow. Here we're looking from the top just to get a perspective on how the broach goes in and the structure of the cancellous bone there with the overhang of the lateral shelf. Putting in a trial socket with a trial socket liner, and we'll do a reduction here to show you. I'm showing you the SurgiSTUD model for the holder, which can be placed in various degrees of beach chair position, and we're doing reduction and maneuvers out laterally, forward, and internally.